Hi, it's me again, Shani, your friendly pharmacist, and let's talk about influenza and colds. How can you tell the difference if it's cold or the flu? And is a yearly flu shot really worth it? Both the cold and flu share some not fun symptoms. They're hard to tell apart because they have so much in common. Runny or stuffy noses, loss of appetite and hardcore nausea, fever, body aches and pains, fatigue and tiredness, chills and sweating, sneezing, coughing, sore throat, and the overall consuming feeling of discomfort. Colds and flus are widespread in wintertime or in cold seasons and hit your upper respiratory area hard. You also catch colds and flu the same way. To become infected, the virus has to get one of your mucous membranes, the moist lining of the nostrils, eyes, or mouth. This happens through inhalation or touching contaminated surfaces, and then touching your face. In spite of these apparent similarities, the common cold and influenza are caused by different viruses that settle in the different places in your body. In other words, they're the immunological equivalent. More than 200 types of rhinovirus cause colds, and they target the nose and throat. 2 types of influenza virus cause the flu in humans, and they target the nose, throat, and lungs. As for stomach flu, it's not actually a flu because it's not caused by the influenza virus, but something else. So how can I tell which one I've got? Just remember the facts. F for fever, A for aches, C for chills, T for tiredness, and S for sudden onset. That means flu. The main difference between the flu and the common cold is that you are more likely to have fever, chills, and muscle aches with the flu. Symptoms of the flu often hits suddenly and cause you to become weaker and weaker, like 1 minute you're Superman, and then the next you're Superman plus kryptonite. Cold develop more slowly and are typically milder. Both the common cold and flu can lead to complications, but the flu is more serious. It could be even life-threatening. It's time to go see a doctor right now if you have any of the following on top of flu-like symptoms: trouble breathing, shortness of breath, pain or pressure in your chest or abdomen, sudden dizziness, confusion, severe or persistent vomiting, symptoms that improve but return with fever and cough or fever with thrush. If you're tired of guessing, you could go to the doctor and get a test to either diagnose or rule out of the flu, but there's still such thing as a test for colds yet. If you test positive for the flu, and you have my deepest sympathies. Your doctor could prescribe a drug called oseltamivir. It's not a cure, but if you take it within 48 hours, it might cut the number of miserable days in your future. And to deal with fever and muscle aches, you can take over-the-counter acetaminophen or ibuprofen. And also, get plenty of rest, as if you'll want to do anything but attach yourself into a couch for the duration. Drink lots of fluid, eat a light diet, and stay at home to make sure you don't infect others. If you have a cold, now what? Nothing. There is no cure for a cold either. You have to let it run its course. Don't ask your doctor for antibiotics because remember, colds are caused by a virus, and antibiotics only work on bacterial infections, not viral infections. You're going to have to settle for the same lame home remedies as for the flu. Rest, fluids, ibuprofen, blah blah blah. Take a decongestant if you're stuffy. The smartest thing to do for a cold or flu is not to get them in the first place. For the flu, the best way to do is that get the flu vaccine. In fact, people intend to get the flu vaccine this year. The best time to get the flu vaccine is, of course, before the flu season starts. And trivia, why is the flu vaccine given yearly? Because flu viruses are constantly changing. Flu vaccines may be updated from one season to the next. It takes about 2 weeks for its protective benefits to kick in, so don't hold off. The vaccine is safe and you can't get the flu from the flu shot. I repeat, you cannot get the flu from the flu shot. Talk with your healthcare provider about if and which vaccine to get if one of the following describes you. First, you have an allergy to egg proteins or other ingredients in the flu shot. Second, Guillain-Barré syndrome, a paralyzing illness at some point. Third, you had a bad reaction to a previous flu shot. And fourth, if you're pregnant. And there are plenty of places to get free flu shots like major drugstores and grocery stores. So you can do your duty as a healthy citizen and restock your snack stash in a single stop. And by this time, if you don't know the drill, I can help you do all the stuff to keep you well and stop the spread of viruses. Wash your hands thoroughly with soap and water. No soap, no water, no problem. Use an alcohol-based hand sanitizer and stop touching your face. Avoid being around sick people when you're well, and avoid being around well people when you're sick. Plus, eat healthy foods, exercise, and get enough rest. To recap, if your symptoms come on suddenly and are more like fever, muscle and body aches, chills, and fatigue, you may have the flu. If you're dealing with a mild cough, sneezing, congestions, runny nose, and sore throat, it's likely a cold. How many flu shots have you gotten this year? I hope it's not more than one. Flu shots is an important public health initiative, as getting vaccinated against influenza can significantly reduce the risk of illness, complications, and the overall impact of the flu on individuals and communities. If you learned through this video, please like, share, and hit the notification for more updated videos. See you next time!
To proceed with free online consultation, click the link in the comment section.